Welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary anatomy and histology. Okay. Question number first. The intercellular junction which prevent the leakage of material from the lumen is options A. Zonula occludens, options B. Zonula adherens, option C. Macula adherens, or options D. Nexus. The right answer is options A, that is a zonula occludens. The intercellular junction which prevent the leakage of material from the lumen is known as zonula occludens. These are the tight junction. Okay. The intercellular junction which hold the cells firmly together known as zona adherens. They are the anchoring junction. Okay. The intercellular junction which is a communicating junction. They communicate two cells together, that is known as a nexus or gap junction. Questions number second. The ground substance which is found in arteries is options A. Heparin sulfate. Options B. Dermatin sulfate. Option C. Hyaluronan. Options D. Chondroitin sulfate. The right answer is options A. That is a heparin sulfate. Okay. The ground substance which is mainly found in artery, that is known as heparin sulfate. If we see that the blood vessels wall, we found there are different layer. There's a tunica intima, tunica media, tunica adventitia, from that inside to the outside layer. Tunica intima is the innermost layer, which is mainly made up of endothelial and subendothelial cells, while tunica media is that middle layer, which is made up of elastic fiber. Tunica adventitia is that outermost layer, which is mainly composed of nerves and tiny vessels. And if we see that the tunica intima, which is also mainly composed of a different type of layer, like that endothelium is the innermost part of the tunica intima, and there's a subendothelial layer, and that's the outer layer of tunica intima, there's an internal elastic membrane. Okay. Questions number 3. The light band of skeletal muscles is interconnected by options A, I line, options B, H line, option C, M line, options D, Z line. The right answer is options D, that is a Z line. Okay. I band, which is a isotropic band of skeletal muscles, are mainly interconnected by Z line. Okay. The I band also known as a light band, and it's mainly contain only actin, that is a thin filament, while the dark band, that is known as anisotropic band, contain both that actin, that's light filament, and myosin, that's a dark filament. Okay. And at the middle of this the thin filament, there's a dark line which is known as a Z line, and distant from that one Z line to that another Z line, that is known as a sarcomere, which is a functional unit of myofibril 2. Okay. And this sarcomere got shortened so when that muscles contract. Okay. And H zone is the zone which contain only myosin filament. There is a lacking of actin filament. Okay. And the M line is the line which is presents at the middle of this H zone, and there's also this M line is also the middle of this sarcomere unit. Questions number 4. The mammary gland is classified based on the mode of release of secretory product is options A, merocrine gland, options B, apocrine gland, option C, holocrine gland, options D, cytocrine gland. The right answer is options B, that is apocrine gland. Okay. On the basis of a mode of release of secretions, the glands are of following types. Like merocrine glands are those glands which release their secretions by means of exocytosis process. There is no any cell damage. For example of this merocrine gland is salivary gland. Okay. Apocrine gland is those glands in which during the release of that secretory product, the top of the cells are also lost. For example, there's a mammary gland. Okay. Holocrine is that whole cells burst along with the release of the secretion. For example, of holocrine gland, that's sebaceous gland. Okay. Questions number 5. Stratum compactum, which is a layer which is a rich in collagen fiber, is mainly seen in stomach of options A, dog, options B, goat, option C, sheep, options D, cattle. The right answer is options A, that is a dog. Okay. Stratum compactum, which is a layer of which is rich in collagen fibers, is mainly seen in the stomach of carnivorous. Okay. Questions number 6. Macula densa is a part which is seen in options A, proximal convoluted tubules, options B, distal convoluted tubules, option C, thin loop of Henle, options D, collecting duct. The right answer is options B, that's a distal convoluted tubules. Macula densa is a regions where the distal convoluted tubules touches that glomerulus. Its main function is to sense sodium chloride concentrations in that filtrate and activate that tubuloglomerular feedback, which adjusts that glomerulus filtration rate to regulate the concentration of tubular sodiums and chloride. Okay, let's see the different part of a nephron with their function. Then if we see that's nephron, the first part is the renal corpuscles, which is mainly includes that glomerulus filtrate membrane, and there is a that Bowman capsules, and they generates glomerulus filtrate, which is mainly composed of waters, ions, and small molecules. Okay, after that there is a proximal convoluted tubules which reabsorb sodium, chloride, potassium, water, glucose, amino acids, bicarbonates, calcium, and phosphates from that urine to that cells, and they secretes the ammonium and creatinine from that cells to the urine. Okay, after that there's a thin descending loop of Henle which reabsorb water. After that there's a thin ascending loop of Henle which reabsorbs sodiums and chloride. After that there's a thick ascending loop of Henle which reabsorbs against ammoniums and sodiums and chloride. After that there's a distal convoluted tubules where the reabsorption of sodium and chloride take place. After that there's a collecting duct which reabsorbs sodium, chloride, and water and secretes ammonium, hydrogen ion, and potassium. Questions number 7. The pulmonary surfactant is the secretory product of options A, type 1st pneumocytes, options B, type 2nd pneumocytes, option C, pulmonary macrophages, options D, membranous pneumocytes. The right answer is options B, that's a type 2nd pneumocytes. Okay, pulmonary surfactant is a secretory product of a type 2nd pneumocytes. If we see that is the lungs, the alveolar epithelium is mainly composed of, there's a two type of cells. We found as a type 1st pneumocyte cells and type 2nd pneumocyte cells. Type 1st pneumocyte cells are squamous cells and they possess centrally placed nucleus and they contain thin cytoplasm, whilst type 2nd pneumocytes are rounded in shape and they also projected into the lumen of the alveolus. And if we see that internally this alveolar surface is mainly covered by the thin film of the surfactant, and this the major function of this pulmonary surfactant is to reduce the surface tension of alveoli, and it is majorly produced by type 2nd pneumocyte cells. Okay, questions number 8. The parafollicular cells are present in options A, pituitary gland, options B, pineal gland, option C, thyroid gland, options D, adrenal gland. The right answer is option C, that's a thyroid gland. Okay, the parafollicular cells, which is also known as C cells, they are mainly found in thyroid gland and they mainly secrete calcitonin hormone. The major function of calcitonin hormone is to that bring the calcium from that blood level to and deposit into that bone. Okay, chief cells and auxophyll cells are the cells which are mainly found in a parathyroid gland, where chief cell secretes parathormone hormone and auxophyll cells function is still unknown. Okay, spongiocytes and chromaffin cells are mainly found in adrenal gland, where chromaffin cells produce catecholamine, that's epinephrine and norepinephrine. Okay, questions number 9. The muscularis mucosa absence in options A, rumen, options B, abomasum, options C, omasum, options D, jejunum. The right answer is options A, which is a rumen. Okay, muscularis mucosa layer is absent in rumen. Okay, if we see that's the wall of the rumen, it is mainly composed of tunica serosa, which is the outermost covering, mainly composed of collagen and elastic fibers, covered by simple epithelium, that's mesotheliums. After that tunica serosa, there's a tunica muscularis, which is mainly composed of two type of layer of muscles fiber, inner circular and that outer longitudinal, in which in this layer that nerves, plexus, and ganglia are present. After that, there's a tunica submucosa, which is mainly composed of there's a lamina propria, which is composed of collagen, elastic fibers, and reticular fibers, along with plenty of blood capillaries. And there's also muscularis mucosa and glands, which actually presents in mucosa layer. But in this case of in this case of rumen, this muscularis mucosa and glands are absent. Okay, and there's a tunica mucosa, which is the innermost layer, which is mainly lined with stratified squamous epitheliums like epidermis of skin. It also presents stratums corneums, stratums granulosums, stratums spinosums, and stratums basilaris. Line with from it, these layers are from that outside to the inside level. Okay, if we see that's reticulums, it is same as rumen. But in case of that omasums and abomasum, this muscularis mucosa layers, which is presence in that tunica submucosa, is presence in omasums and abomasums. Okay. Questions number 10. Corpora amylaceae is seen in options A, prostate gland, options B, pineal gland, Option C, parotid gland. Option D, testis. The right answer is option A, which is a prostate gland. Okay. Corpora amyloacea, which is a stars-like body, is a small hyaline masses which is mainly found in this prostate gland. In case of that benign prostatic acne, it is also seen in case of nervous systems, lungs, and sometimes in other organ of body too. Okay. Questions number 11. Cal-axonal bodies are seen in options A, testis, options B, ovary, option C, adrenal, options D, thyroid. The right answer is option B, that is ovary. Cal-axonal bodies, which is giving a follicle-like appearance, are small eosinophilic fluid-filled punched out space, which is mainly seen between granulosa cells, and it's a pathognomic lesions for a granulosa cells tumor. Okay. Questions number 12. The bone of the antebrachial region is options A, humerus, options B, radius, option C, carpal, options D, metacarpal. The right answer is options B, that is a radial. Okay. Brachial regions is that the regions which is superior from this antebrachial regions, and is mainly consist of that upper arm, the area between that the shoulder joints and the elbow joints, and the bone included in this brachial region is we can see that's a humerus. Okay, while antebrachial region is a line which is a lie between this elbow joints and the hand, and the bone included in this antebrachial region is that's radius and ulna. Questions number 13. The fabula are seen in dog in the options A, shoulder joint, options B, stifle joint, option C, carpal joint, options D, hock joint. The right answer is options B, that is stifle joints. The fabula are seen in the dog in the stifle joints. Okay. This fabula is a sesamoid bone that is embedded in the lateral head of the gastrocnemius muscles, and often articulate directly with the lateral femoral condyle. It is mainly found in this stifle joints. Okay. Questions number 14. The largest cervical vertebra is options A, first, options B, second, option C, sixth, options D, seventh. The right answer is options D, that is the seventh. Okay. C7 is the largest cervical vertebra, while C1 and C2 are the smallest cervical vertebra. Questions number 15. In the cow, mediation take place approximately options A, 10 to 22 days, options B, 5 to 10 days, option C, 1 to 2 days, options D, 40 to 45 days. The right answer is options A, that is 10 to 22 days. Let's see the day of maternal recognition of pregnancy, day of attachment, and that's molecules involved in that pregnancy recognitions of different species. If in case of cow, that's the maternal recognitions of pregnancy done by 16 to 17 days, and that embryo get attached to the uterus at 18 to 22 days, and the molecules which is mainly involved for this maternal recognitions is that bovine trophoblast protein, which is interferon tau first. Okay. In case of a mare, that maternal recognition take place at 14 to 16 days, and the attachment, the day at which that embryo get attached to the uterus at 36 to 38 day, and the major molecules which is involved from during maternal recognition is estrogen protein. In case of EU, that maternal recognitions of pregnancy take place is 12 to 13 days. The day of attachments of that embryo is 16, and the that major molecules which is involved during maternal recognition is ovine trophoblast protein. In case of DOI, there's a day of maternal recognitions of pregnancy occurs at 17 days of the ovulations. Day of attachments is there is no given, and there's a Heparin trophoblast protein first is the major protein which is involved during that maternal recognitions process. Okay, in case of so that maternal recognitions take place at 12 days. Questions number 16. Mandible is derivatives of options A, first brachial arch, options B, second brachial arch, option C, third brachial arch, options D, fourth brachial arch. The right answer is options A, that is the first brachial arch. Mandible is derivatives of first brachial arch, or we can say that's pharyngeal arch. This pharyngeal arches or brachial arches are the mesenchymal condensation, which is mainly derived from neural crest cells, majorly, or in intra-embryonic mesoderms. If we see that these pharyngeal arches are mainly that's mesodermal derivatives, while pharyngeal pharyngeals okay pharyngeals pouches are mainly endodermal origins. Okay, है ना? We already discussed about the derivatives of that the pharyngeal pouches. Okay, in previous video. Let's see the derivatives of brachial arc and pharyngeal arc. Then from that brachial arch and pharyngeal arch, there's a nerves, muscles, and arteries which are derived from that specific pharyngeal arches. The if we see that the first arch, it's mean all the structures which is start from that M are derived from that first arch. It's a mnemonics, okay. Um, if we see that's the nerves which is derived from the first arch, that's the mandibular nerves. Muscles, let's see the muscles, that's mastication muscles and mylohyoid muscles. Anterobelly of digastric, this is exceptions, okay, we should learn about it, okay. Tensor tympani, which is actually the muscles of this middle ear, so it is also start from M. And tensor palatini, let's remember this tensor palatini. If we see that's artery, maxillary artery, okay. Second arch, the nerves which is derived from the second arch, that is facial nerves. And also there's a muscles, also facials, muscles of facials expressions. And there's a if it that's anterior belly of digastrix originate from that first arch, then posterior belly of digastric origin from that second arch. And we should remember that stapedius muscles, okay na? And there's a stapedial artery, okay. If we see that's third arch, then glossopharyngeal nerves, and there's a stylopharyngeal muscles and common carotid artery, which is originate from this third arch. And if we see that's fourth arch, there's a fourth arch. We should remember that fourth arch by means of larynx, by means of pharynx, and sixth arch by means of larynx. Okay, superior laryngeal branch of vagus nerves is originate from that fourth arch, and muscles of pharynx is origin from this fourth arch. Okay, and muscles of larynx except cricothyroids origin from sixth arch, and recurrent laryngeal branch, vagus nerves recurrent laryngeal branch from sixth arch, while superior laryngeal branch of vagus nerves is originate from fourth arch. Okay. Uh, Muscles of larynx, okay, muscles of larynx accepts cricothyroids origin from sixth arch, okay. And if we see that's artery, ductus arteriosus and pulmonary artery is actually originate from sixth arch, okay. Questions number 17. There's a single occipital condyle in options A, fowl, options B, ox, option C, dog, options D, horse. The right answer is options A, which is a fowl, okay. Single occipital condyle is present in case of fowl. Occipital is a single cranial bone of skull, forms superior and posterior aspect of the skull, and it's mainly consists of three parts. There's a lateral mass, basi-occipitals, and supra-occipitals. And if we see that's lateral mass, it is mainly comprised of that condyle, and there's a foramen magnum and paramastroids process, and condylite fossa, hypoglossal foramen, and condylite foramen. Okay, and this condyle is actually oval elongated structures, which is majorly two in number in most of that animal except in fowl, and included that foramen magnum between in them in cattle. Okay, and this foramen magnums actually give passes to that spinal cord, and this condyle articulate with atlas behind. Okay, questions number 18. Conus arteriosus is a bulbous swelling at the origin of options A, aorta, options B, coronary artery, option C, pulmonary trunk, options D, none. The right answer is option C, which is a pulmonary trunk. Okay. Conus arteriosus, which is also known as infundibulum, is a conical pouch which is formed from the upper and left angle of the right ventricles in that coded heart, from where these the pulmonary trunk arises. Okay, it is mainly developed from a bulbous codis, and if the defect in this infundibulum development can result in a heart conditions which is known as tetralogy of Fallot. Okay, questions number 19. Bicipital group of humerus is subdivided by vertical ridge in options A, horse, options B, ox, option C, dog, options D, fowl. The right answer is options A, that is a horse. Okay, bicipital groups is again subdivided by vertical ridge in case of horse. Let's see some fact which is related to humerus. Then we found there's a prominent deltoid tuberosity in case of horse. Bicipital groups are divided again by ridge in case of horse. There is a Newton foramina which is actually located in that the posterior surface, but in case of horse it is found in the medial surface of the humerus. Okay, and radial and olecranon fossa, which is actually communicated by the large supratrochlear foramina in case of dog. Okay. Questions number 20. Sigmoid flexor is absent in option C, horse, options B, ox, option C, dog, Options D, horse and dog. The right answer is options D, that is a horse and dog. Okay. Sigmoid flexor is absent in case of horse and dog, while seminal vesicles and bulbourethral glands are absent in case of dog. External urethral opening presents at a tip of glands, and abdominal, in case of that's a dog too, no? Abdominal testes are present in fowl. Okay. Questions number 21st. Number of lobes in liver of dog is options A 5, options B 4, options C 6, options D 3. The right answer is options A, which is a 5. Okay. Number of lobes of livers in dog, that is 5 in number. That is a left lateral, left central, right centrals, and caudate lobes. Okay. A number of lobes in the liver of ruminant, that is a 4 lobes. That's left and right hepatic lobes, quadrate lobes, and caudate lobes. Okay. Number of lobes in case of liver of in horse, that's a 3 lobes, left lobes, right lobes, and middle lobes. And in case of a horse, we should remember that's gallbladder is absent in case of horse. Okay. Number of lobes in liver in case of pig, that's a 4 main lobes, that's a right lateral, right central, and left lateral, and left central, and there's a 1 small caudate lobes. Okay. Number of lobes of livers in case of fowl, that's a 2 lobes, left and right. Number of lobes of livers in case of rabbit, which is same as like of dog, that's 5 lobes. Okay, that if we should remember that the blood is supplied to the liver by the two blood vessels, that's a portal vein and there's a hepatic artery. Only 20% of the blood is supplied by this hepatic artery, and which is a nutritional supply, which mainly contain oxygen. Okay, and the functional supply is mainly done by portal vein, which is the 80% supplied by this portal vein. Okay. Questions number 22. Out of the total volumes, rumen occupies options A 80% of the abdominal cavity, options B 70%, options C 60%, options D 55%. The right answer is options A, that is 80%. Okay, 80% out of the total volumes, rumen occupies 80% of the abdominal cavity. Rumen is the largest compartment of ruminal stomach, almost occupy most of the left side and small part of the right half of the abdominal cavity. But at the if we see that the size of the different compartment is not same from the birth of the animal, at the time of the during the new birth, at the bedtime, at the time the rumen and reticulum is smaller as compared to the abomasum, where the abomasum is well developed. Since we can see that's the newborn, there's rumen and reticulums double time the size of the abomasums, and in case when the animal reach up to that 8th week, the rumen and reticulums size equal to that abomasums, and when the 12th week, the half of the size of the rumen and reticulums is the size of the abomasums. Okay. Questions number 23. Junction between vomer and sphenoid's bone is options A syndesmosis, options B suture, option C stylosis, options D hinge. The right answer is option C, that is a stylosis. Stylosis is an articulation in which two bones are joined by fitting the ridge of the one bone into the groove of the another bone. Okay, are also known as wedge and groove joint. Example like junction between vomer's and sphenoid's bone. Okay. Questions number 24. Brachiocephalic trunk originate at the level of options A 4th ribs, options B 6th ribs, option C 5th ribs, options D 7th ribs. The right answer is options A, that's the 4th ribs. Okay. Brachiocephalic trunk originates from the arc of the aorta at the level of 4th ribs. Okay. If we see that's heart is a cone-shaped organ situated at the ventral half of the middle mediastinums, with the base directed upward and the apex directed downward. The base extends from the 3rd to 6th ribs and placed about 10 to 12 centimeter below the spine. And the weight of an adult heart is about 0.4 to 0.5% of the total body weight. Okay. Questions number 25. At a termination of a vertebral canal, a laches of long nerves root attaches to the spinal cord and are called options A conus medullaris, options B pholum terminates, option C cauda equina, options D both A and B. The right answer is option C, that's a cauda equina. At the termination of a vertebral canal, a laches of a long nerve roots attaches to the spinal cords, which are look like as a horse tail in appearance. So they are called cauda equina. Okay. Most distal bulbous part of the spinal cord, that is a conus medullaris. Okay. The filum terminale is a fibrous band that extend from this conus medullaris to the periosteums of that coccyx. Function is to fixate, stabilize, and buffer the distal spinal cord from normal and abnormal cephalic and caudal traction. Questions number 26. Pons is separated dorsally from cerebellum by options A, third ventricles, options B, lateral ventricles, option C, both A and B, options D, fourth ventricles. The right answer is option D, that's the fourth ventricles. Pons is separated dorsally from cerebellum by fourth ventricles and ventrally from that medulla oblongata by inferior pontine sulcus. Okay. The tentorium is the fold of dura mater which actually separate the cerebellum and cerebrum. Okay. And if you see that's behind the pons, a transverse brain dispersons which is called corpus trapezoidiums. Okay. While corpus callosum is located at the interjunction of two cerebral hemisphere. Okay. Questions number 27. Cavum laryngis is cavity of and is closed during deglutination by options A, larynx, vocal cord, options B, syrinx epiglottis, option C, larynx epiglottis, options D, syrinx vocal cord. The right answer is option that's C, larynx epiglottis. Cavum laryngis is a cavity which is found in the larynx and is closed during deglutination, which means swallowings by epiglottis to prevent food to enter into respiratory tract. Note that's a vocal box of poultry. That's a fowl is known as syrinx, which is also known as caudal larynx. Okay. Questions number 28. In which dash canal contain in addition to external pubic vessels and nerves and dash ligament of uterus? Options say inguinal broad, options B femoral thick, option C infraorbital broad, options D medullary thin. The right answer is options A, that's inguinals and broad. Okay, in which inguinal canals contain in addition to the external pubic vessels and nerves and broad ligament of uterus. Okay, inguinal canal are the two passes in that anterior abdominal wall of the animal, which in male convey the spermatic cord, and in female it's mainly convey the round ligaments of uterus. Okay. Questions number 29. L-shaped cardiac nodes is present in dash lungs of dash. Option C, left lungs of ox. Options B, right lungs of ox. Option C, left lungs of dog. Or options D, right lungs of dog. The right answer is options A, which is the left lungs of ox. Okay. L-shaped cardiac nodes is present in left lungs of ox. Let's see some fact related to the lungs. Then the right lungs of cattle has 4 lobes, which is apical, cardiac, diaphragmatic, and accessories or intermediate lobes, while the left lungs of cattle has 3 lobes, that's apical, cardiac, and diaphragmatic lobes. Okay. Right lungs of dog has 4 lobes, which is apical, cardiac, diaphragmatic, and accessory, while left lungs of a dog has 2 lobes, apical and diaphragmatic only. Right lungs of pig and rabbit has 4 lobes, apical, cardiac, diaphragmatic, and intermediate, while the left lung of pig has 2 lobes, apicocardiac and diaphragmatic. Right lungs of horse has 3 lobes, cranial, caudal, and accessory, while left lungs has 2 lobes, cranial and caudal only. Okay. Questions number 30. The ribs of the fowls can be distinguished because of options A, absence of costal cartilage, options B, presence of uncinate process, option C, because there are 7 pairs in numbers, options D, all. The right answer is options D, that's all. Okay. Ribs of fowls or poultry has following characteristic. First, they are 7 pair in number. Okay. Second, there is absence of a costal cartilage. Okay, and each ribs has a dorsal and a ventral surface. First 2 ribs do not extend up to the sternums. Okay, each of the dorsal segment of second to sixth ribs poses a caudal extension known as uncinate process, which major function is to support the thoracic cage in a better way by overlapping the succeeding ribs. Okay, thank you.